Here.
See if I could turn off that LA. It's cramping. It's
Sorry.
so unflattering.
Hey, everybody, it's Dr. Ashley, pediatric emergency mom, and I am here today talking with my friend Dr. Karen, who is a pediatrician in New Orleans. And we're talking about fluoride and those articles that just came out and that study that was published about fluoride. So I'll let Dr. Karen introduce herself.
Hi, everybody. I'm a pediatrician in Kenner, in the Oshner Kenner Medical Office Building, but I have my own practice, Cypress Pediatrics. Been doing it for a little while, but I've always followed Dr. Ashley. She's always got great advice, and I really love the breakdown she did on the articles that we had spoken about a couple days ago when I first kind of was getting an inkling that we were going to start getting some interesting questions from parents. So I said, let's head this off at the pass and just kind of provide some information ahead of some bad information that might be coming out.
And
So,
I think like people, maybe a lot of people don't realize that when these
mhm,
things pop up in the
right,
news, it becomes a very hot topic in visits with pediatricians.
right. So yeah, the what had happened was I was watching a morning program and everything was on nothing about fluoride at all. The literally last 2 seconds, the commentator just said, "Hey, did you hear that? Like fluoride can drop your IQ points." And then he spoke it to somebody else, and they were like, "Oh, they kind of made a little joke." And then end of show. So I said, "This is not way to throw us all under the bus because." It was incorrect information. The article wasn't being discussed. The veracity of the article or the truthfulness of the article wasn't being addressed at all. And I knew we were going to be getting a lot of questions from parents. Well, why are you doing this? What are you doing? What does this do? Is this going to poison my child? So I said, we need to, let's put some good information out about why we do this and what's important.
And in all fairness to parents, um, and I want to hear your take on this too.
Hmm.
So there are two articles, right? Like when I looked for the New
Yeah,
York Times article, there's the January 8th article, but then there's also a December 12th article. And so the December 12th article is the benefits and risks of fluoride explained, which
right.
is great, very informative. But then the January article is the
Right.
one that's going to scare the bejesus out of parents, right?
Yeah. Hmm.
Study links high fluoride exposure to lower IQs in
Right.
children, which is it's a terrifying
Right.
thing for a parent to read.
So when someone picks and chooses a title like that, they don't realize that especially parents who are busy parents, you're working, you got to take care of your kids, meals, driving, carpool, all that stuff. So you may just hear fluoride drops my kids' IQ points instead of hearing, oh, okay, because that title isn't entirely incorrect. It's just that they failed to mention high fluoride, and we've known the danger of high fluoride. It's called fluorinosis, and it's actually it's can high fluoride can cause problems, but so can low fluoride. So like everything in life, as well, a little bit of something can be not good and a lot of something can be not good. So we need to find that balance where the fluoride can actually provide the benefits of our health and our children's health, and not tip the scale to the higher lows. That's the goal.
Yeah, exactly. And I'll be honest, I didn't in reading so I read the article and then I found the study that was published in JAMA. And I didn't know what the average, what the US's level is in drinking water for fluoride.
Hmm.
I didn't know. I had to look it up.
Yeah, I looked it up
Um,
as well. It's interesting. I learned a lot of facts, just kind of double checking where we are. In a state or local. I looked up Baton Rouge, I looked up New Orleans, I looked up here in Jefferson Parish, and it's interesting. So and I also learned. I mean, I did not realize that there was a natural fluoride level that water contains, and it's just not high enough to help protect the children's teeth. when they aren't getting fluoride from any other sources, like from toothpaste or something like that. So I don't know if you want to review any numbers, or you want me to throw some out. I could, if you want me to. Or
Yeah. You can, if you're, I can just really quick
yeah,
run through the
go for it.
studies that the JAMA article was based on,
Yeah,
and
yeah,
just
go.
I did it the other day, but just if people are listening to this for the first time, and but I tell people, like, these lives, a lot of the time, like we're all busy, we're working, we're zipping here and there, so like this is my kind of poor man's podcast, really. So you can play it in the car, like you don't have to watch us, right? But so the National Institute of Health and the environmental section published this meta-analysis. So basically they looked at lots of different studies and tried to, um, layman's terms, kind of mash that all together to give one set of results, which is like okay for some things, but none of these studies were done in the United States. So there were 74 studies. None of them were done in the United States. 64 of them were cross-sectional studies, which is where you observe data in a
Right.
population at one point in time. And 10 were cohorts, so studying a group of people with a shared characteristic. And I found it very interesting that they did note that of all of these studies, 52 had a high level of bias, meaning like the study
Right.
design could have been better. There's confounding factors. There's other things to
Mhm.
consider. And 22 had a low risk of bias. So um, it's I think it's good to compare studies that are looking at IQs and fluoride. I don't think it's great to, especially in this age of misinformation and people taking a little bit of something and running with it,
Right.
to share it on the
On
scale that
yeah,
it was. Yeah.
I
So
agree.
those are the studies, and if you want to talk about the fluoride and the levels.
Yeah, so I was looking at the general consensus about what an acceptable level that is tooth protective is 0.7 parts per million, which is pretty much what New Orleans and Jefferson Parish have in our water. Baton Rouge is just a smidge higher at 0.8, but that's still within it should be 0.7 to 1.0. So 0.8 is not in the danger level at all. So that's still pretty good. I could not get any information on St. John the Baptist. St. John Parish, though, was 0.81, and St. Charles was 0.8. So it seems like they're kind of hovering in that a little bit on the just slight high to not high, but higher than the average is. Unfortunately, looking at all the other states, we were ranking, and this was from a study that I saw from 2020. I could not get any more current data, but as of 2020, Louisiana was 46th in the nation in our dental care and our our fluoride levels. So we have a lot to go. But I think once again there's confounding factors. I mean, I know so many people. We could put it in the water, but the problem is that if we're not drinking that water, we're not getting the fluoride. So if you're a family that doesn't drink out of the tap your tap at home, which I do, I feel like we have great water. I just keep it cold, but I cannot convince many patients to say, okay, well, I think I'll try the tap water, because I think there's a lot of skepticism about our public water. We get these water bottles,
Mm,
say, we're not gonna drink out of the tap, but and then they buy those Dasani bottles or whatever, and so they're not getting any fluoride. But if they're brushing their teeth with fluoridated toothpaste, then that's going to make up for it. And if you see the dentist and you get fluoride treatments there, you're good. Um, where pediatricians come in is that we are the first line of defense, because we see newborns' teeth before any other professional does. I'm the one who sees like, I just saw like 3 little teeth today. So for the first time, 3 patients, 3 little teeth. So we are the ones who have to be the advocates for dental care, telling mom it's, to do this. And it's it's important that, a lot of parents, well, why is it important? They're going to fall out anyway. Yeah, they're children's teeth, but there's pain involved. There's missing school involved. There's surgery. A lot of kids I know, the parents, and I'm not trying to be, but for cultural reasons or whatever, the parents didn't feel the need to assert that you need to brush your teeth. So the kids have to undergo surgery to get stuff taken care of. And that's not easy. We don't like any kids to go under anesthesia that don't have to. So what we try to do in pediatrics is catch the kids early, with a fluoride treatment, get them to the dentist. Now the dentists get overrun too. So we're kind of an intermediate where they can get a fluoride treatment with us every 6 months in between their dental visit, or if they happen to go a longer time, we try to catch them, and get them their fluoride treatments and kind of review dental health and kind of keep that mantra going so parents can really kind of start picking up with the children's dental care.
And just
Sorry,
in
that was
case people,
long-winded.
no, it's perfect. It's perfect. But in case people didn't get to read the articles or didn't see,
Right.
the rates at which there was a slight IQ dip, and
Yeah,
let's be
really.
honest, we're talking 1 point
Exactly.
in the IQ measurement, that there was a slight dip, was levels above 2
Mm-hmm.
milligrams per liter,
Right.
and under 1.5 milligrams per liter, it was null, meaning like there was no correlation.
Right.
They didn't see that dip in the IQ score. So the fact that our drinking water is 0.7, 0.8, I mean, that's well below that
Right.
1.5. And
Yes.
even if you account for the fluoride in toothpaste and the fluoride treatments, it's still well below that level where they saw
Right.
the IQ dip. And then you bring up a really good point that I honestly kind of hadn't thought about, because we too drink tap water. We're in Baton Rouge. Like, I think I told you, my husband has written a couple of water report cards for the state, because that's part of his study, his PhD, hydrology, and all the things I don't understand. But anyway, so he tells me wherever we are, oh, this place has clean water. Don't drink the water here. This
Right.
one's okay.
Mm-hmm.
So, but I hadn't considered the people that do not drink tap water. And
Mm-hmm.
then if you compound that with the fact that they aren't brushing,
Mm-hmm.
then this is, high risk for tooth decay.
Yeah. So for infants, we recommend, for the first 6 months, for your baby water that you get like in the stores or whatever, to mix your bottles with, or no fluoride. But once they hit 6 months when those teeth are really starting to amp up, you want to get the fluoride added to the baby water. Because parents ask,
See,
what's
and
the difference between one and the other? I'm like, that's the difference right there. So
this is so interesting, and why you are really good at general peds and I am not great at general ped. We don't do the day-to-day stuff, right? But now that I'm thinking back on it, I don't know that I think I used tap water for my kids
yeah,
when I was mixing their formula.
right. But it had the fluoride in it, so
Yeah,
you were good. They were good. Yeah.
but like before 6
Oh, from the
months.
beginning. Yeah.
Yeah. I mean, they're good. They're smart.
Well,
They're good. I don't know.
they maybe they take after their dad. I don't know. I'm just kidding. I'm kidding. Set me
Oh
up.
my gosh. Um, but I think that and another point about this, and I looked at a couple of studies, and I really tried to truly analyze these things objectively as you do as well. It's impossible to read 74 studies. It just
Right.
I cannot imagine a worse way to spend my day.
Yeah.
But from the couple that I did skim, even the IQ testing, one set of testing,
Right. You could have a bad day, and it could make a difference.
yeah,
viewpoint. Now if you were telling me that the kids had 10 points, I'd say that's a big difference. So, but you could be tired and the night before your test you didn't sleep well because you were nervous about it, whatever. So one point is not a statistical difference, really. So
Right.
even if that title is 100% accurate in that it did cause lower IQs, the lower IQ is 1 point. So I mean, I'm not saying, hey, like we all need every point we can get, but I'm just saying that, like,
right. And
that,
I think like if the title would have said study links high fluoride exposure parentheses United States isn't high to lower IQs parentheses 1 point lower, right?
right,
Then we have like a less sensationalized
right,
but more accurate title.
yeah, I agree.
So since obviously it's very new, I think the study was published on January 6th and then the article came out on the 8th.
Yeah.
Have you gotten questions from parents yet on this?
I haven't actually gotten as many as I thought I was going to get, and I feel like this is just, I think it hasn't really made the rounds yet, and I'm hoping that the people who are critically looking at whether they're going to discuss this on the news because it's such a sensational title actually look at it and say, you know what, that study is not even accurate. Let's not even talk about it. So I'm hoping that's what's going on. But I know nowadays, as we amp into a new political age, I think we're going to be hearing a lot more pushback on things that we do because of fear, and that's what concerns me. Like if I wasn't in science and I didn't have like wasn't a critical thinker in the sense of knowing how to just take apart an article and say, okay, this is not right and this is inaccurate. I would hear that art title and I'd be like, okay, no way, you're not going to give my kid a fluoride, and but then then I would sit down and discuss with a parent, okay, where are you getting this information? Let's talk about what it says. I'm going to look it up. We're going to see, and we're going to make sure we're making decisions based on good information and not fear. So
Right.
that's where I think I don't think we've heard the end of it either. I'm hoping maybe people will listen to, especially your amazing analysis of that article, of the two articles, and they'll say, yeah, those two articles are basically bunk science. So, but the sensationalism of it is going to resonate, and that's what I'm afraid of. So,
Yeah, I think you're right. And to go through this critically and objectively, like, takes a ton of time.
it
I mean,
does.
it really does.
Yeah.
Um, which is like I kind of like doing it. It's like an investigation, trying to get to the bottom of things. But not but like you said, not everybody is trained to do that. Certainly or and even the people that are trained to do it don't often have the time to do
Right.
it, to really dig into it.
Yeah.
And you mentioned, some kids like culturally or because of lack of resources that aren't brushing their teeth, or and another added thing to that I'll say is the number of patients that I still see in the emergency
Mhm.
department that don't realize that you can't once babies have teeth, that you cannot give them that bottle and put them to bed.
Yes.
And so the number of cavities, dental pain,
Mhm.
dental abscesses that
Right.
we see in the emergency department, um, which I tell parents, like, I'm always happy to assess you, but I am not a dentist.
Right.
And also the number of kids who, even though I know that their medical homes, their pediatricians are saying you need a dental home, right? You need to see the dentist. But I'll see kids that are way older than I would think that have
Right.
never seen the dentist before. And so
Mhm.
it's those little touches, those little misses where that little bit of fluoride in the water makes a huge impact.
Mhm. Yeah. Yeah, that's true. Yeah. So even with the babies, with the you'd mentioned in yesterday's talk about using the toddler toothpaste, and I'm sure Dr. Strickland can talk more about this. But we say, well, use the toddler toothpaste. The reason we don't use the grown up toothpaste on them is because they can't spit it out. So then they would swallow all that fluoride, and then that would be bad for them. So once again, too much bad, too little bad. We want the right amount. So what we do encourage is, at least I from what I'm reading, I have been looking into. I recommend, just like, you pull off a peel the size of a grain of rice, and you put that on the baby toothbrush 2 times a week, and just kind of brush your teeth with that. You can rinse it out afterwards, or they can swallow it, because it's, once again, a small amount, so it's not going to be causing any problems. But yeah, it's but if you don't start with good habits, it's really, really hard. And then those kids get those adult teeth, and then it's really difficult. It's tough. I do always, if I have a parent who's really resistant to give up that nighttime bottle, we say, okay, give them the bottle, then brush your teeth, but you can't let them fall asleep with that bottle. First of all, it's bad for ear infections, okay, and it's also gonna erode those teeth. Your teeth need a break. They need a break, so that all the critters in your mouth that are good are gonna go in there and repair any dentin that got damaged through the day and from your food and bacteria. So that is one thing that I recommend. And then every now and then I will show a parent what bottle mouth syndrome looks like. So I encourage anybody who really wants to see what I'm sure you see in the emergency room, go look up bottle mouth syndrome. You will brush your kids' teeth. It's scared straight right there. So
Yeah, it's and sometimes I'll just say it, or like they've been sick, they maybe have some sleep regression, and kind of talking through that, and like, well, he didn't even want to take his nighttime bottle. And when they say things like that, that's when I'll take a moment, like, wait a minute, do you mean like bottle and bed? Oh yeah. Okay, no, let's talk about this. Like, even though
yeah,
it's not an emergent
really hard.
issue,
Yeah, it's
but
really
it's
hard.
still like it's super important to talk about, because I've seen so many kids with that bottle mouth, and it is just heartbreaking.
Yeah. I know, and these cute little smiles, and they have all these little black teeth, and it's so sad, and you just know it could have been prevented, But if you like, if we have parents who just can't give up the bottle, I'm like, okay, but only water. If you're gonna give them
Yeah.
the bottle, water's it. That's all they're gonna get, and guess what? They're gonna sleep better too. We're gonna work on
Hmm.
getting them to sleep longer, and guess what? If they sleep longer, what happens for your
You
sleep?
sleep longer.
Ah, you get to sleep better too. Yay! Isn't that great?
Oh my gosh. Yeah, that's absolutely true. This is a total random fact. And I feel like like college was so long ago, but I remember one thing that like really stands out to me from my mass communications class, and it was like advertising or something. And so, in toothpaste commercials, how when they put the toothpaste, it's that like loop, that
Oh, that beautiful,
beautiful
yeah.
kind of thing,
Yeah.
because they want you to put tons of toothpaste
Well, yeah.
so that you'll have to buy more toothpaste, right?
Right. Hmm.
Well, I remember my professor teaching us that the actual amount of toothpaste that needs to be on your toothbrush is called a nurdle.
Huh.
That's the unit of measurement.
What
Yes.
is a nurdle, Ashley?
How I remember that, I don't know. There's so much else I've forgotten over the
Yeah.
years. But yeah, to your point about that little small amount of toothpaste, and my younger son, we kept on the baby toothpaste. He still has like the younger kid toothpaste.
Hmm.
Only in the past few years has he stopped like swallowing over 50% of the toothpaste. So even though we have these
Do you
ages,
need
you're
a
right.
DEXA
Like,
scan for his
yeah, yeah,
bones?
right. But it is hard as a parent. It's hard to keep up with all of this information. And as a pediatrician, I know like how you guys keep track of all the things you have to go through on visits is just I don't know how y'all keep up with it.
Well, we study hard, we work hard, yeah, we go through a lot, but you want the kids to do great. You want them to succeed. You want them have like nice, long, happy lives, so, and so do the parents. Sometimes they're just a little misguided. Not all parents, of course, but some of them they just get a little caught up, and some parents have, especially the nighttime models, have a really hard time saying no, and they want their babies to be babies for longer. But
yeah,
that's a whole other conversation, another day. So.
yeah. And like just we have like 5 minutes left, but you bring up a good point of we want everybody's babies to be safe and healthy, and we want to help parents facilitate that happening. And so with all of the changes in the amount of information that's readily available and the quality of information that's readily available, or lack of quality of information that's available.
Yeah.
We we went to school for a long time to do this. Our our goal hasn't changed, right? From the time we graduated from medical school and we took the Hippocratic Oath, our goal hasn't changed. And so we're certainly, I know I speak for both of us, we're not here to deceive anyone. We're just here to educate, and our goal is to keep kids healthy so they can grow into wonderful, well-balanced adults.
Amen.
Amen. All right. Well, Dr. Karen, thank you so much for, or I don't know if I should thank you or not thank you for bringing these articles to my attention.
Hey, I'm thankful you did the deep dive in the articles, so because you're very good at that. So I'll be bringing some more articles for you too, I'm sure. So happy to talk about it anytime. So
I'm ready. I just need I need a leash so I don't get too far down certain rabbit holes, because you can really, really get down these rabbit holes when you're, going through all of this stuff.
Right.
But, well, thank you so much for joining.
Thank you for all you do for the moms in the community and dispelling stuff and educating. I think you do an awesome job and really help boost us as pediatricians, because we know you provide the same information that we do, but sometimes it helps, you have to hear it from two different people sometimes to really get it in there, to realize, oh yeah, she's talking about. So
my pediatrician was right.
Yes, thank you. We appreciate that.
All right, thank you, Karen.
All right, have a good night. We'll talk to you later.
You too. Bye.